one of the nation's top public health threats.
Hello, I'm Alex Moore, and this is 15 Minutes Superbugs Edition. Recently, the United Nations held a meeting on global health and safety. This is only the fourth time in history that a high-level General Assembly meeting has been held on a health issue. The UN Secretary General, Ban Ki-moon of South Korea, stated that antimicrobial resistance is a fundamental threat to global health and safety. Antimicrobial resistance is when bacteria become resistant to antibiotic drugs. This is also known as superbugs. So how exactly do bacteria become resistant to antibiotics? Well, it happens when bacteria are exposed to small, weak doses of antibiotics. And these small, weak doses occur from misuses of antibiotics and patients being prescribed antibiotics when they really have viral infections.
There have been several national and international meetings about antibiotic stewardship, and you're correct that there was a United Nations meeting.
We were also able to contact epidemiologist Sarah Lineberger and nurse Carol Jamerson from the Virginia Department of Health in Richmond. An epidemiologist is a scientist who studies the spread of diseases. We asked her what the effects of superbugs in hospitals or other medical situations was. She explained that if a patient was determined to have an antibiotic-resistant substance in a pre-surgical screening, the operation is delayed and the patient is given a very strong antibiotic. All of this can cost $700 to $2,000 a day. These days, a delay in hospitals can cost patients and the hospital lots of money.
Okay, so the bacteria can pick up a plasmid, and so they're picking up, DNA other than their own, and the plasmid could be carrying the resistance gene. Yeah. So that's one way that resistance can spread from bacteria to bacteria. Like you might have healthy bacteria, and then you're in the hospital for surgery, and you might come into contact with some bacteria that has a plasmid that makes the bacteria resistant. So then that plasmid can be transferred from the bad bacteria to your good bacteria, and then all of a sudden your good bacteria can start becoming resistant because they picked up that plasmid that carries the resistance gene.
Ms. Lingberger also said if a patient was not screened or passed the test and went through an operation, this could lead to an infection, which could kill a patient. These infections could also spread. Dr. Bella CDC, in her LNBC interview, said that several severe diseases could also make a comeback because of untreated superbugs, including malaria, tuberculosis, HIV, pneumonia, and gonorrhea.
Another contributor to antibacterial resistance is when patients with viral infections are prescribed antibiotics. Antibiotics do not treat viral infections. Doctors often feel pressured by patients and prescribe them anyways. Patients also feel the need to walk out of the office with drugs.
In days past, most of the time people were not satisfied until they went home with a prescription for an antibiotic to get better. So to answer the question, why do doctors prescribe antibiotics, it's often because the patient is insistent on having something. They feel like they're paying for a doctor visit, they're sick, they're missing time from work, their child's missing time from school, so they want to get better today. So they go to the doctor and expect to have something given to them to help them get better. So what we're trying to do, and I think what doctors are doing a much better job with now, is we're trying to educate patients to the difference between a virus and a bacterial infection. And there are ways to treat viruses, and sometimes they require an antiviral, like influenza or flu can be treated with an antiviral medication, but an antibiotic is not going to change it. So, we're trying to educate people the difference. We're trying to let them know there are things that are helpful to help a virus go away, and give them a prescription path, so to speak, of things that can help them that are not related to an antibiotic.
misuse of antibiotics also results from users not completing their prescribed doses. For example, a patient is prescribed medicine for 10 days, but he or she only follows the course for 6. Many people do this in hopes of saving money, and sometimes patients also feel that they no longer need to use the drugs.
Patients should not be treated with antibiotics for a viral infection. The careful use of the proper antibiotic related to the situation that's going on, whether the surgery may be for infection or the surgery may be to correct a problem, they're still going to be giving some antibiotics in and around the time of that surgery. And there's some national guidelines depending on the type of surgery, so what antibiotic to give and how long to give it. So the careful use of the antibiotic is to follow that guideline and not prolong the use of it, because the prolonged use of the antibiotic can cause the bacteria to develop resistance.
According to Dr. Beth Bell, another major contributor to antibiotic resistance is horticulture. In meat production, the livestock are fed liberal amounts of antibiotics in order to stimulate muscle growth.
We decided it was important to ask Dr. Jamerson and Dr. Lineberger exactly how they are trying to stop the spread of superbugs in the state of Virginia.
We're involved with, in Virginia, matches a national program that's called Get Smart About Antibiotics, and it's a dedicated week every year. It's really a national campaign to help people think about getting smart about taking an antibiotic. And the reason it happens in the fall is because we're entering the cold and flu season, so they're trying to get that message out before that season gets started so rapidly. And we're doing some cool programs in Virginia where we've participated in that national effort, and we're going to have a big educational summit this winter where we're inviting healthcare professionals from the community, from hospitals, from nursing homes, and we're really going to have national speakers, some state expert speakers to really talk about the problem and come together as a group and collaborate on how we can tackle antibiotic resistance in Virginia.
We asked about the severity of superbugs and the toll they are taking on us as humans.
The CDC actually estimated that drug-resistant bacteria caused 23,000 deaths and 2 million illnesses annually in the United States.
In conclusion, we as Americans and as humans need to begin to worry about the possible and probable threats that superbugs carry. Antibiotic-resistant bacteria is, as Dr. Jamerson has said, one of our nation's top health concerns, and something needs to be done to combat these harmful pests. That starts with me, you, and anyone living on this earth.